Hi, welcome back. I'm Gordon Banks. It's good to see you today. We're going to talk to Dr. Cavallo. We're here in Dallas, Texas. He is an expert in the field of asthma. You say, well, I'm an athlete. Well, athletes, we need our lungs. We have to breathe good and good, strong lungs. And asthma is one of those things that can affect you without you sometimes realizing or not knowing it. And sometimes you do realize it, but you know what to do about it. Dr. Cavallo, welcome. It's good to see you today.
Thanks. It's nice to be here.
Now, you're an expert in the field of asthma?
I'm an expert in pulmonary diseases. I deal with a number of diseases of the chest, and asthma is a very common condition that I see here in my office.
If I'm a kid, I'm growing up, I don't have a history of asthma, but I'm having some issues. What are some of the symptoms of asthma?
Well, asthma is a chronic illness.
Okay.
Basically a condition that causes inflammation and tightness of the windpipes, which are the conduit through which air gets in and out of your chest. And you imagine if your windpipes start to tighten up and there is a difficulty in breathing there. For an athlete, that's very important.
Okay.
Continuing, it's a chronic illness. It may be present for a lifetime, and it's eminently treatable with medication. Generally, you will understand if you have a respiratory condition like asthma because the symptoms are very important. There's a lot of coughing, respiratory difficulty, wheezing, and difficulty to exercise if you're an athlete. So generally a person will have an idea that something is wrong with them. And yes, as you said, sometimes patients have periods where they have absolutely no symptoms, or they can have symptoms by doing absolutely nothing. You break down asthma in asthma that comes off and on. We call that intermittent. And then we break down in persistent asthma, which is asthma that's present most of the time for patients. And these patients are the ones that have the most symptoms.
Is it genetic? Is it passed on in your genes? Is it something that you just kind of contract? Is there anything that you could do to not get asthma?
Well, you can break that question in a number of things. Yes, there is a genetic component.
Okay.
Not all patients, it's actually, most patients are not, don't have asthma on a genetic basis. But if there's a family history of allergies, itchy eyes, or rhinitis, conjunctivitis, rashes, these are the type of patients that have more of a genetic component to it. You can have asthma out of the blue. Most patients develop asthma before age 7. 75% of the patients will know there will be some kind of manifestation of asthma before and at age 7. But you can actually develop asthma on a late age. And unfortunately, there is nothing you can actually do to stop asthma presenting, but you can do a number of things to prevent it and to make it less likely that you will have an attack of asthma.
Okay. So there's some treatments. So if I'm an athlete now and I'm having some difficulty, maybe I didn't recognize it when I was 7, maybe it wasn't diagnosed, maybe my family couldn't take me to the doctor because of financial reasons or whatever, and I've kind of navigated through it. But now you're opening up my eyes. You're seeing it and saying, man, that maybe is me. What are some of the things that a person could do?
Well, it is very important that you seek medical attention. You will not be able to manage your asthma properly if you don't have some good guidance.
Okay.
Okay. And the first thing you need to understand is break down with your physician what type of asthma you actually have. Do you have the intermittent that comes off and on? Do you have the permanent asthma that's there all the time? Is it mild? Is it moderate? Is it severe? And nowadays there's a very clear understanding how to treat it, and there is very simple stepwise build-up of medication that you can give to a patient that can make him feel well. Most of the time, most patients have good control of their asthma.
Okay, so let's say if an athlete, sometimes an athlete doesn't want to diagnose that he has an issue because he feels like it's going to cut off his athletic career. But you're saying that's not necessarily the case because you can treat it and work through it.
Yeah, one answer about your comment is this: if you are an athlete that have asthma, and you have fear of talking about it, that's not exactly a beneficial way to look at this problem, because as an athlete with asthma, you're going to perform below your best.
Yeah.
And if you are treated, you're going to be able to show your best.
Right.
And so it is it's very important that you seek attention and get with your physician and create what's called an action plan based on your diagnosis, your severity, the type of medications you can take, and you can go from there and do very well. Now, I just wanted to mention also that besides the type of asthma that I discussed here, there's a condition called exercise-induced asthma, where a person is generally well, but when they exercise, they will develop asthma symptoms. It is believed that the cool and dry air that is bathing your lung when you're exercising heavily will cause tightening of the windpipes and can make you have symptoms. So if an athlete has difficulty breathing and think there's a condition that is causing that, it's very important they immediately seek attention and be helped.
Okay. So when you're one of rinse sprints at the end of practice and you start getting winded, you got, that's not necessarily the condition, but it's really when it's prolonged.
Yes, exactly. You're saying that very well. It's let's say I am an athlete and I play soccer, and suddenly I realize that the same effort that I used to be able to manage, now between 10 and 15 minutes when I start exercising, I cannot run with my colleagues anymore, my peers playing soccer.
Right.
And also the individual will notice that it takes much longer to recover from the exercise, to recover from the effort. It takes maybe 30 to 60 minutes to get your breathing back to the way you felt before. That is more or less how exercise-induced asthma will present.
And one of the keys, playing sports for so long, there are so many guys that have issues. And so like Dr. Cavallo said, it's not that you have to mitigate it yourself. You take it to a professional, somebody that knows what they're doing, and they're going to help you so that you can perform at your highest levels. Don't hide it. Hiding is not going to solve it. You talked about an action plan. What was the term that you actually used, and how would somebody go about finding
a physician working with a youngster or a young adult that's have asthma will, again, as I said, try to find out where this individual falls in the brackets of severity of the illness. And if they have a more challenging case, the individual will be given a device to monitor your own asthma, which is called a peak flow meter. It's a small device that you can hold in your hand. You take a very deep breath and you blow on it, and you can see a number that shows how good you can blow air out of your chest.
Okay.
That is a good correlation. That has a very reasonable correlation with symptoms of asthma and the presence of asthma. Because when you're having a severe attack of asthma or you're poor to control, the windpipes will tighten up, or the windpipes will swell up so that flow reduces. And the first step, of course, is to find out what is the person's best. You give to your patient a flow meter device. The individual goes out, and when he or she is feeling great, we'll do several maneuvers and find out this is my best.
Yeah. So right.
And then let's say your best is a 650 liters per minute. At that point, you can make an action plan based on that number.
Right.
If an individual falls to 70% below that, you can start implementing some measures. If you fall below 50% of that best, you can start stepping up the treatment, and you're going that way. And it's interesting because some patients, when they have asthma, they actually don't realize how bad it is. And they say, well, maybe they're stoic, maybe they're tough, they just don't feel it. But when you use your peak flow meter, you understand that you are not properly treated. That's very important to understand, because asthma not only is a tightening of the windpipe by the muscles, but there's also a lot of inflammation inside the windpipe, which renders the gauge narrower. And this inflammation is not meant to stay there. It's very important that throughout your life you treat yourself with medication. You do not allow that inflammation to set in and stay, because it can cause a progressive loss of lung function over time. I see in my practice individuals that are 70, 60 years old who had asthma as youngsters, were not treated, and now they have a fixed obstruction of the windpipes that cannot really get better.
Okay.
All right? So that action plan looks at your medications to maintain you well, medications to keep you out of troubles. And when you're in serious trouble, you need to seek medical attention immediately. Talk to your talk to your doctor on the telephone. I need to emphasize that you have to have a physician that you have good communication with. If you don't have good communication with your doctor or the nurse, that's not going to help you.
Right.
And it's based on that you are going to be able to control your asthma and get to the full potential of your athletic life.
Right. And boy, there's really a key there. See, while you're young, we have a tendency to overcome challenges or issues because we're athletes and we're disciplined and we're strong. But that's not what Dr. Cavallo is saying. He's saying if you'll deal with it while you're young and not try to overcome it, but get to a medical professional so that the teamwork of your drive and his know-how and wisdom, that's going to protect you not only now so that you perform at your best, but also long-term so that when you're at the end of your life, you have a strong, healthy life. Well, I appreciate it, Dr. Cavallo.
Thank you,
great job.
Appreciate it. Thank you very much.
Outstanding stuff. Take care of yourself. This is great information. Take it to heart. You're going to get better. You're going to stay healthy, and good things are in store.
Thank
you very much.
Thank you very much.
Appreciate it.